And for more on this, let's speak to Dr. Nick Maynard, a consultant surgeon who regularly visits Gaza, most recently in July, joining us live now from Oxford in the UK. Thank you very much for giving us your time, Dr. Maynard. It must be so upsetting for you every time that you do go back to the Gaza Strip to see how much worse it is. This famine that's been declared now, the first in the Middle East, is it in line with what you have experienced there and what you've witnessed?
Hello, thanks for asking me on. Most certainly, and as you say, it's desperately upsetting each time I go back there. The famine is every bit as bad as they describe. It's worse than that, actually. The amount of deaths I saw in babies, children, adults every day when I was there recently was really appalling to behold. And this has been going on for a long time. I mean, I'm not remotely surprised by this report. Indeed, a year ago, the IPC released, they've been releasing reports regularly, but a year ago they were saying a famine was imminent. When I was there last summer, a year ago, on one of my trips there, we called out the imminent famine there. I was seeing deaths at that stage over a year ago. So it's much, much worse. I'm not at all surprised by this report. Is exactly what we are seeing over there. And there will be many, many more deaths every single day now this is happening. So it's terrible to behold.
Dr. Maynard, there's something I really want to ask you, because throughout all of this, when we talk about famine, when the world has seen photos of starving children, starving people in Gaza, we're talking, I mean, now we're seeing it on the screens there, skin and bone. The Israeli line has always been that these are pictures of people that already have prior illnesses, muscle atrophy, if you like, because of diseases that they have. What would you say to that?
Well, they're lying. I mean, it's simple as that. And it's really disappointing. We keep have to addressing this Israeli propaganda as if it bears any credibility whatsoever. Listen, children with pre-existing illnesses, of course, will be more vulnerable to the famine, to the malnutrition. But it doesn't mean just because there are children who have other comorbidities who are starving, it doesn't mean that it's not affecting other children without comorbidities. Of course it is. It just reveals it more quickly in those children. But I have seen with my own eyes perfectly healthy children prior to this starving and dying. I can tell you about little Zainab, who was a 7-month-old girl I was with only a few weeks ago. She looked like a newborn. You could see every single bone in her body underneath her skin. She had no muscle visible at all. She was being fed with 10% dextrose, which is effectively sugar water with no nutritional value at all, because there was no formula feed. She died whilst I was there 3 or 4 weeks ago. And she died whilst doctors were at the border trying to get into Gaza with suitcases of formula feed. And the formula feed was being confiscated, was being taken away by the Israeli border guards. Those bottles of formula feed could have saved little Zainab's life, but the Israeli border guards were removing them from luggage so nothing could get into Gaza.
That actually brings me to that question, because we've heard this not just from yourself now. This is a repeated remark by many of the doctors and nurses that are going, that have tried so desperately to bring in, as you said, baby formula, much needed packs. I don't know what you'd call them, medical packs with nutrients. What's so dangerous, if you like, about these items that Israel thinks it needs to take them and confiscate them?
Well, there's nothing dangerous about them at all. We've been told repeatedly we can't bring in anything that could remotely be used as a weapon. So surgical instruments, things like that, we don't bring in. But it is impossible to imagine what other purpose formula feed or other nutrients can be other than to feed children and to save lives. So it is part of their deliberate policy to starve the population of Gaza.
Dr. Maynard, you've spoken many times about the patterns of injuries that you have seen over the times that you've been there. And can you describe to us how that has been changing in terms of those patterns? Because you have mentioned gunshot wounds, which you weren't seeing probably perhaps earlier on. Can you talk to us more about that?
Yes, of course. On all my visits to Gaza since October the 7th, 2023, I've seen terrible, terrible injuries, mainly explosive injuries, killing babies, toddlers, children, adults. But my most recent trip, and we saw a lot of that, but my most recent trip, I also saw a lot of gunshot wounds. And these were almost exclusively in young male teenagers who were being shot at the Gaza Humanitarian Foundation food distribution points. Just to remind everyone, these were the American and Israeli joint operations pretending to distribute food to the population. There's only 4 of them in Gaza, and they are death traps. And these young teenage boys were going to these food distribution points to get food for their starving families and were being shot. And not only were they being shot, but there was specific targeting of different body parts on particular days. So one day we would see lots of young teenage boys being brought in with gunshot wounds to the head and the neck. Another day they'd be shot in the chest. Another day they'd all be confined to the abdomen. Another day to the arms and legs. And one day, in my 3rd week there, we had 4 young teenage boys brought in, all of whom had been shot in the testicles.
I mean, that is targeted, Dr. Maynard. There's no other way to describe it, really. Sorry to interrupt you there. Just again, so much to cover, but we're running out of time. Dr. Maynard, whenever you go back, how much, I'm not just talking in terms of the famine, but also the conditions that you're seeing around you, the conditions in the health centres or the hospitals or what's left of it. How much worse is it, and how can it get any more worse than it is already?
Well, it's worse each time. I mean, I was in Nasser Hospital as most recent visit. It's the last partly functioning major hospital in the whole of Gaza now. It can't possibly cope with all the injuries it gets. We were operating with really limited resources, very, very difficult to operate sometimes because of the lack of instrumentation, the lack of blood products, the lack of basic sterile equipment and gloves and things. So it is virtually completely disabled, the healthcare system. And if it gets any worse, then they will have no functioning healthcare system at all. That is how dire the situation is. The doctors and nurses, the Gazan doctors and nurses and other healthcare workers are almost on their knees. They've been working this way for 22 months. They are mentally, physically exhausted. They're starving as well. Doctors and friends I know who I hadn't seen for a year, I hardly recognise because they'd lost, some of them, nearly 30, 40 kilograms in weight. So the health system is virtually completely broken now.
Dr. Nick Maynard, thanks very much for all of what you're doing for really humanity. Dr. Nick Maynard, who's been going to Gaza for more than a decade, a consultant surgeon from the UK.
Don't miss out and get the full picture. Subscribe to Aljazeera for reliable news and expert insights. Like, share, stay ahead.